Happy Wednesday.
Happy Wednesday.
I was just diving in a little bit to give a little overview of what we're talking about today, but I'd reached out to Diandra with Triple Negative Breast Cancer Awareness Month here, right? To talk about what exactly is triple negative breast cancer, because I don't know if you found this, but I talk to breast cancer survivors all day. And some women still just don't quite understand the difference between triple negative breast cancer and someone that has hormone positive breast cancer. So
Sure.
real briefly about that, but then also curious onto how to fuel your body with triple negative breast cancer. And I'm sure Diandra will dive all into the science behind everything for us. Let's start off with, I'll go over my general understanding of triple negative breast cancer, but then if you will add in, that would be awesome. My understanding is triple negative breast cancer is more aggressive, right? It grows faster, it spreads faster, and because it lacks the receptors for estrogen and progesterone, as well as HER2, there's not as many treatment options available for this kind of cancer, right? That's my general overview. What do you have to add?
So it's interesting. I think it depends on who you're talking to, because when I met with my first oncologist, he explained the receptors, and the way that he laid it out is he was showing that younger women tend to have more hormone positive cancers because we have a lot of estrogen and progesterone in our bodies. And so he said that actually the hormone positive, in his case, in his hospital, he saw that those tended to be more aggressive, yet more treatable. So that's why they throw all the hormone therapies and chemotherapies, radiation, everything at women with hormone positive cancer. And then he said that actually, as people get older, the receptors tend to drop off. You may have had hormone positive when you were young. When you're older, you may end up with a hormone negative cancer, and that being that you don't have the estrogen to fuel it. He saw in his practice personally, the triple negative tended to be less aggressive and later on in life, and he saw an increase in the hormone positive for younger women. So I think it really depends on where you're at. And so he did say, though, with the triple negative, because you're lacking those receptors, there's nothing for the targeted therapies to attach to. So you look at the hormone positivity. These are receptors that when our estrogen or progesterone binds to that, our body's hormones, that it turns on growth. So you don't have these growth receptors, but then at the same time, it's still cancer and it's still being able to develop and move faster than a normal healthy cell would. I thought that was interesting, hearing from someone who's been in the practice for a long time that they typically see it later. But I think one of the interesting things is young women with the triple negative breast cancer, it's more likely that they have a genetic mutation that is linked to that. So BRCA1 or BRCA2 mutation carriers have an increased chance of this triple negative. And the reason for that is this mutation means that you have this impaired ability to repair from DNA damage. And so as you're getting assaulted by different things in your environment all the time, anything in your food, your water, your air, stress that we're under, it's going to be harder for it to repair any damages from that. So that's why we're seeing more triple negative in younger women, is that there potentially is a genetic driver. My mutation that I have, it's called FANCM, and it's a more rare genetic mutation. But when I looked it up initially, it said increased chance of triple negative breast cancer, yet I have hormone positive. So I think it's really interesting that it's not really age specific. And even if you do have a mutation, it doesn't mean that you can't get a hormone positive cancer. Today, what we're going to talk about is we have the estrogen and progesterone, the two hormone receptors, and HER2, it's a receptor on the outside of the cells, and it's a similar thing. So instead of estrogen binding, this is something that's actually triggering the cells to grow faster. Then when we get to the triple negative, there's no estrogen and there's none of these HER2 receptors. So there's no way to really identify the cancer separate from healthy cells. And so that's why they suggest the more aggressive chemotherapies. They may want you into surgery more quickly because there's no way to really pull back that growth. So I say to pretty much anyone, if you're being offered a lumpectomy, go for it, because that's always the least invasive and you're never going to get better than a lumpectomy. Is that the same thing that you've heard, Brynn?
Yeah, absolutely. I feel like I'm with you. Yeah. So if they're rushing you to make a quick decision about something, a lumpectomy, you could always go from there, right? Mm-hmm. But if you choose to have whether a single or double mastectomy, which that decision may change because, like you said, most triple negative breast cancer survivors or people going through treatment for it have a genetic mutation. So more than likely a mastectomy is going to be a better choice for you anyways. But yes, you can always start with a lumpectomy and then go from there based off of what happens, how effective treatment is, all of the follow-up that is in regards to that. But I feel like also most of the research with the genetic mutations is with BRCA1 related to triple negative. But I have met so many triple negative survivors who are BRCA2. Yeah. So there's no, this is it, and this is how it's going to be, right? We're individuals, our bodies are different. This is why it's good to have providers that you feel empowered to work with and are advocating for your health. And if you feel like you need more information, programs like what Diandra offers are really a good way to get that baseline information. So you know all of this, right? Yes, so you go in and you're like, hey, I've got all of my stuff. I know what I'm talking about. And you make better empowered choices.
Absolutely. And one of the things I did want to mention as we're talking about the surgery concept, that I've seen a lot of women who either on their own or with doctors' guidance that they choose that they want to do ovarian removal. And so one of the things I want to mention with triple negative cancer, it's not fueled by estrogen. If you are removing your ovaries, that's not going to impact your cancer. It may reduce your risk of ovarian cancer, of other gynecological cancers. And if you're done with having children, then there's a whole another reason that you may want to have them removed, and it's all your choice, and that's perfectly fine. But if you have an oncologist that is suggesting, hey, you have this aggressive triple negative cancer, we should do everything, and they say that they've seen good success rates with ovarian removal, you need to think logically with that and say, why are they saying this? And they're saying it because they're concerned that you could also maybe then have a hormone-positive cancer in the future. They're just looking more generally, and they're not really looking specific to your case and saying, if we're only concerned about triple negative, then what should we be moving forward with? And that would be more like the regular surgery, the mastectomy or double mastectomy. But you wouldn't need to be rushing into having your ovaries removed because your cancer is not feeding on that and it's not responding to that.
Yeah, such a good point to make, because estrogen is good for us as women as we age, right? It is really good for our bones, for our cognition, like body composition, so many things. Estrogen provides us with great things. So as a woman with triple negative breast cancer, worrying about your ovaries is low down on the list. You don't have a genetic mutation that says, hey, you're more at risk for ovarian cancer. And that is really good information to step back on that decision for sure. Exactly. So just like treatment is not one size fits all, right? Life after breast cancer is not one size fits all. Fueling your body, which is what we're going to talk about today, nutrition, is not one size fits all. I like to use the term being bio-individual. What works for me may not work for you, and vice versa. We're going to go over a little bit of blanketed information here about how to fuel your body, specifically for triple negative breast cancers. So I would like to know your thoughts about what would be the ideal way to eat after a triple negative breast cancer diagnosis.
Yeah, It actually reminds me of my course that I just launched called Thrive from the Start. And so in this course, what I've done is I've gone through your diagnosis all the way up through treatment. That's what I have right now. And then I have a portion for life after cancer as well. This question comes up actually in my risk factors lesson. So it's early on. I think that it's important for us to know maybe what is within our control, because with cancer, so much is outside of our control. So if there's something like food that you can make a choice, a conscious decision every day to contribute to your health, then I want that to be known. I'm going to pull just a few things from that lesson that I have. And then if you want any more information, you can add a comment in the chat and I can send you the link. But the first thing that I have for triple negative breast cancer and for hormone positive cancers is looking at healthy fats. We all know that the processed foods are not really good for us, and they might have a lot of saturated fats that are really just going to be causing a lot of inflammation in our bodies. There are two different kinds of fatty acids. And so this is something from my research that I've done in nutritional sciences. There's two different pathways. The first one is the omega-3s. We've heard of these as being the heart healthy fats. Those are things that you might see in supplements. They actually help to reduce inflammation, and they're something that everyone needs. So they're a part of our cell walls. They're in every cell of our body. These are really important fats that we need. Then we have these omega-6s. We have them in the same kind of like pathways, so they match each other. But what's different is the sixes, they are the kind of oils or fats that can go rancid quicker. They oxidize, they fall apart, they cause inflammation. So while we do need some of those in our cells for a well-balanced, healthy diet and functioning immune system, what we don't need is an overabundance of this. So there has been research that looked at adding extra omega-3s into someone's diet versus taking out some of these inflammatory omega-6s. And what they found out is that it's actually the balance. So it's the ratio you want to have between a 1-to-1 balance or up to a max of maybe a 3-to-1. So for every 3 of these harmful, more inflammatory omega-6s, you have 1 of those healthy omega-3s. And so if you were to eat more red meat, that's going to bring up the 6s. But the reason that the Mediterranean diet is focused on salmon or some of these smaller fish, like sardines that are healthier for you, is because they have closer to that 1-to-1 ratio or 3-to-1 ratio where they're having very low levels of omega-6s. I'm vegan, so I don't eat fish, but a great source of these omega-3s is going to be the flax seeds. We actually talked about that in the soy and breast cancer YouTube video. You have that as an option. You also have nuts and seeds and avocados that are going to have that. It's really up to you. If you want to add in the fish, then that's great. And maybe take away some of the red meat. That would be a good shift. But it's really just for you personally. And I like to give a little warning when we talk about fish that there's a white fish called tilapia, and I think the ratio is somewhere around a 12-to-1. It's really high in omega-6s. And what we found is that it shouldn't really be considered in that same category of the healthy fish. Wild-caught salmon is really good because it's going through its normal migration pattern and it's eating up all of these omega-3s from the algae. There's a lot of ways to incorporate it, and it's really just being smart and knowing how to read the labels at the grocery store for that, or going more for those plant-based sources.
Mm-hmm. Yeah, so good. Yeah, I'm real big on food being an investment, right? So think about it, especially with fish. Salmon, for instance, you can go to the store and find salmon for $6-7 a pound or $20 a pound. And that's because there's a quality difference. If you actually were to look at it, you could see the difference. If you feel it, you can feel the difference, right? And that is because, as you're saying, the wild-caught salmon is going to typically be a higher cost, but it's going to be so much better for you. Maybe you can only eat it once or twice a month. Eat the good stuff less often. It'll be way more beneficial than the crappy stuff. And Yeah, I love flax seeds. It's something too that I highly recommend all my clients to add in. I recommend 2 tablespoons a day.
I would say between 1 and 2, typically. 3 is the high end. If you're doing it in smoothie and oatmeal, then you might end up with 3. But yeah, it's actually one of the most cheapest forms of omega-3s. So you don't have to worry about breaking the bank. I think we get a bag that is already ground, so you don't even have to grind it. You just store it in the fridge, and it's good for up to between 2 and 3 weeks before those omega-3s will deteriorate. And then that lasts for between 1 to 2 weeks for $4. And it's 2 people eating it. So yeah, it's very affordable versus the salmon, like you said, might be $20 for a pound versus this flaxseed, it's $4 for a pound, and that's going to last you a couple weeks.
Yeah, yeah, I love that. Yeah. And flaxseed too is full of fiber. It has some magnesium in it, right? A lot of breast cancer survivors have trouble with their sleep. So some flaxseed before you go to bed will not only help with your omegas, it'll help with the magnesium, which is going to help you sleep, and it'll help you poop because you don't want to be constipated, let me tell you. So get those bowels working, and flaxseed's one of the easiest ways. So I love that discussion about that. So omega fatty acids, super, super important. What would be one more tip that you would add in there?
Yeah, the other big tip is to focus on anti-inflammatory foods. I actually was interviewing recently with Oscar Speak, so you can always check out that episode. But one of the things that I talked about on there is there's a researcher called Dr. William Li, and he is one of the founders of the Angiogenesis Foundation. And angiogenesis just means that our body can control what is being fed, what has a blood supply. So normally you have all your organs have all this blood supply. We have blood supply to our brain, but cancer is going to be in a spot typically where it doesn't get that much blood supply initially. The cancer will send signals out to say, hey, I need more food here. Come here to fuel me. And so what Dr. Lee's group looked at is they found out that every cancer that starts in our body starts with one single cell. And so as it replicates, it's going to get to a certain point where it won't be able to grow beyond the size of the head of a pin without an additional blood supply. We could be walking around with very tiny microtumors and everything is perfectly fine. But now when our body is being hijacked and the cancer is sending out these signals, it's called the tumor microenvironment. And that's where it's saying, I need inflammation here. I need to bring blood flow in here. When we talk about an anti-inflammatory diet, that is going to be limiting that inflammation. If you get a cut, like I have a cut here on my finger, yes, I want the inflammation to go there. That's going to cause swelling. It's going to seal off the area. It's going to bring in your immune cells. They're going to attack what's in there, any bacteria, kill it off, and then the inflammation will go away. Short-term inflammation is amazing. It's exactly what we need, and it's what nature designed our bodies to do. But long-term inflammation is not beneficial to us, and this is what can help to fuel cancer. I don't know if you had this, but when I had my mass, I would feel it, and it felt hot. So I could feel a heat coming off of this. And so if you have it like further deep inside one of your tissues, you might not feel that. But if it's a surface level one, you may see that. And that's because there's inflammation there and it's trying to get that fuel. An anti-inflammatory diet is, like Brynn said, high fiber. When we talk about fiber, the general recommendation for the United States, USDA, is about 25 to 30 grams of fiber for an adult human being. So for men, they put it at 30. For women, they put it at 25. But actually, with my diet, I try to double that. So I go for 50 grams of fiber a day, which sounds like a lot, but if you're eating fruits, vegetables, whole grains, beans, nuts, and seeds, then as you add up those servings, you're going to be getting 50 grams or 40 grams, and that's going to be lowering your inflammation. It's going to be helping to flush out extra cholesterol. So it's going to be good all around, and then we're just really squashing that fire. It may not stop it completely, but we're really slowing it down and allowing our other therapies that we're on to do their job and work well.
Yes, so good. Yeah, the inflammation in our bodies really causes a disruption to everything. And it is so easily to decrease that level of inflammation with the foods that you're eating every day. And this is, yes, about giving up a few things, but think of it more in terms of what are you adding to your plate, right? So you're adding these higher fiber foods, right? So you're getting more of the phytonutrients, you're getting all the resveratrol and the folate and all these other really protective things for your body that will help you heal while you're in treatment, but also in life after cancer to prevent recurrence and to have less hot flashes and to sleep better and to have clearer skin and just all of these things. Inflammation, people are catching on to it now, but it's a matter of how do you eat to lower the inflammation. And yeah, that's how I work with my clients too, because it's a way to make you feel really good and you can feel the effect so quickly from it. And in a matter of 3 or 4 days, you can be like, oh, okay, this is how I should be feeling, right? You should be having energy and feeling really good. So yeah, I love that so much. You talked about this earlier, right? One of the best low inflammation way to eat is the Mediterranean diet. If you just want to have a general, right, knowledge base, the Mediterranean diet is the way to do that. But also, I know that you have more information in your course on how to do that. And then I also walk through my clients hand in hand in that too, in that post-cancer life.
Yeah. And Brynn, so what is your program right now that you have going on?
Yeah, so I call it Life Beyond, and it is the blueprint for life after breast cancer. So in that, let's say, year or two after diagnosis, when treatment has settled down and you're just trying to figure out what the hell just happened to you and where to go from there, that's what I help you with. So I call it living a kick-ass life after cancer.
There you go. Yeah. And Brynn, yours are live sessions that you have, right? Okay. Yeah. That's great. Yeah. And because mine complements yours and mine is thrive from the start. As a nutritional scientist, I wanted to do that life beyond cancer. But then I realized there was really a gap that we were lacking for how do people get to that life beyond? How do we get through this initial chaos? So mine is actually an online course. It's an e-course. So I recorded videos, I recorded audio, I have slides, and I have a companion PDF for each lesson. And each lesson is between 5 and 15 minutes long. And it's just focused on a different part of your cancer journey. The first one that I have out now is all about your diagnosis. I talk about those receptors. I go through hormone-positive cancers, HER2-positive cancers, triple negative, and all the different things that you're getting, staging, things like that. And then I move into the second one, which is going to be releasing soon. And that one is the phase of where you decide on treatment. So I have all these options, what is right for me. And as I said, I don't pressure anyone to choose any one type of treatment, but I really just give you all the information. So if you're sitting in the doctor's office with your oncologist and you forget everything that they said, then you can pull up my course and watch the video and just go over it as many times you need and in whatever order you need as well, because that's really going to help you to make empowered and informed choices. And then after I go through this, I'm releasing it gradually. The last 2 modules that I'll have, one is all on mindset, and then the other one is all on this life after cancer and how are we moving forward now that we've made these decisions and really empowering you. So again, that's Thrive from the Start. And so right now I have everything out there for someone who's just been diagnosed. It's the perfect phase to join for that. And then I'll be releasing more information as I have those other 2 modules that are more in that life after cancer before you get to Brynn. And these are ones that you can watch at any point in time, right? It's not a group setting, it's an individual setting, and you feel that you can access it whenever you need.
Yeah, thank you so much for doing this work, because as you talk, it's, oh my gosh, I wish I had that. I wish I had that support and guidance and understanding instead of having to get out there and Google and get scared. Yeah, so thank you for putting good information out there and making things easier for those of us who are recently diagnosed. Yeah. But like you said, you lay that foundation of empowerment and self-advocacy that sets you up to live that kick-ass life after cancer. So yeah, love that so much.
Perfect. Yeah. I think this has been a great session today. So I want to thank everyone that's joined us. And we've been doing this on a monthly basis. So if you have any ideas, any topics that you want Brynn and I to go over, just feel free to shoot either of us a DM, and then we can add that to our list moving forward.
Yeah, would love that. Let us know what you want to know about. And thank you so much for your time, Diandra. And I'll see you again soon. Okay.
All right. Yeah.
Great.
Take care.
Bye.